Hello, my name is Dr. Kierra Barnett, and I'm a senior research scientist in the Center for Child Health Equity and Outcomes Research at Nationwide Children's Hospital. I'm a public health researcher who focuses on structural racism, social determinants of health, and their impact on racial health inequities. The racial disparities that we have seen in maternal and infant health are long lasting, both nationally and at the local level here in Columbus, Ohio. These disparities are driven not by genetics, but by the inequities in the social determinants of health, with housing being a very critical social determinant. Structural racism and discrimination are deeply rooted in housing policies and practices that have created and maintained the segregated community landscape that drive place-based health disparities across the U.S. Despite this, many community development strategies remain race neutral, addressing the socioeconomic disparities within a neighborhood without closing the racial gap. In our paper in the Health Affairs Special Issue on Housing and Health, entitled A History of the Impacts of Discriminatory Policies on Housing and Maternal and Infant Health in an Ohio Neighborhood, my co-authors and I sought not only to understand how state and local policies have affected the Linden neighborhood in Columbus, Ohio, but also explore how community reinvestment strategies informed by structural racism and discrimination could provide a solution and yield lasting change to improve health outcomes. As I mentioned, this study focused on the Linden neighborhood in Columbus, Ohio. Linden has approximately 19,000 residents, of whom 36% are Black and 45% live below the federal poverty level. Compared to the rest of the county, Linden has higher rates of unemployment, residential property vacancies, and rates of violent crimes. Furthermore, Black infant mortality rate in the Linden neighborhood is more than twice the overall infant mortality rate in the county and over 3 times greater than the national rates. We understand, however, that these inequities in both neighborhood level social determinants and infant mortality are not merely the result of individual behavior or choices, but these disparities that we see are the result of a history of discriminatory policies that have disadvantaged the Linden residents. As the first step in an ongoing mixed method study called the Targeted Investment in Meaningful Engagement Study, my colleagues and I conducted an extensive structural racism and discriminatory policy inventory to illustrate how these policies and practice specific to housing played a role in the unacceptably high infant mortality rates that we see in the Linden neighborhood compared to the county and even the rest of the nation. This paper describes the initial policy inventory we compiled and provides a timeline of the structural racism and discrimination affecting housing and health in Linden. We conclude by discussing how reinvestment in communities that is rooted in addressing structural racism and discrimination can create sustainable improvements in health and overall well-being. Thank you.